Good evening, everyone. Thank you for joining us this evening again for our town hall meeting. And, we have a busy schedule, so this evening is mainly about information with the public in our service unit area. And I'll be the moderator this evening. So to begin with, we're going to start off with the opening prayer, and that's going to be rendered by Sasha Nels, who is our nurse. So, Sasha, go ahead.
Hi out there. I am Sasha Nels, and I am the Youth Wellness Nurse for Winslow Indian Healthcare Center, also the COVID School Health Task Force Leader, and welcome you to our town hall meeting that is geared for our Winslow service area schools and the schools that Winslow Indian Healthcare Center serves. And there are actually 24 school sites, several schools on tribal lands, and then we have the schools in the border towns, Winslow, Joseph City, and Holbrook, and they include the public schools and also the private schools as well, and our dormitories. So this meeting is geared toward you and your students, staff, and all the parents, and I welcome you. We want to provide you and present to you some vital information from our leaders, from our local leaders, from those who have updated information on our COVID pandemic. And today we have some information we're going to present to you regarding the most up-to-date data of COVID. And also, we're going to present to you some information from our own Dr. Sage White here at Winslow Indian Healthcare Center. She'll be presenting on the COVID vaccine. And then also, we're going to hear an update from our Department of Diné Education, and also provide you with some community resources that could be of your use, of families out there, for any type of emergency needs. So we'll be providing you that information. But at this time, before we start, I'd like to go ahead and just pray and open up this time with a prayer for all of us that are in this meeting, and for all of our schools and the staff and students. So let's pray. Dear Lord, I want to thank you for a great day that you have given us, God. Thank you for a new day that you gave us today, for the sunshine, for the air that we breathe, Lord. And God, you provide so much for us each day. And even in times of need, we can trust that you're in control, that you're watching over each one of us, and that you're helping us, you're guiding us. And Lord, I pray again, God, over all of our schools, Lord. I pray over all the principals, all the leaders of the schools, as you continue to lead and guide them. I pray for all the students, each one, God, all ages, Lord. I pray for all the parents, God, that you continue to uplift the students and the parents in this time, Lord. No matter what situations they may be facing, God, only you know. And we pray, God, that you will hear their prayers too, Lord, that God, whatever their needs are today, that you would meet them. I pray, God, for our healthcare staff, Lord. I pray you continue to provide them strength every day, Lord, the endurance that they need, Lord. And we ask that you continue to sustain us, that you will heal our land, God, and we trust you, and we give you this time, this meeting, and may it provide us the information that we need, that we can take it and put it to use, Lord, for good, that we will continue to be careful in this time and take care of one another. And again, God, we thank you. I pray all these things in the name of Jesus. Amen.
Thank you, Sasha, for that beautiful prayer. Ladies and gentlemen, we are now live, so hello, Facebook, everyone on there. Thank you for tuning in this evening. We just had the prayer done, and now we're going to be going on to our first presenter, and that's going to be given by Alicia Gishi from Winslow Indian Healthcare Center. Go ahead, Alicia.
Hi, good evening, everyone. Like Pac said, my name is Alicia Gishi, and I serve as the liaison officer for Winslow Indian Healthcare Center. And just real briefly, a quick update as far as what's happening here at our facility for numbers. And these are numbers that are as of Friday, January 8th, 11:59 p.m. And number of tests performed is 19,182. Number of tests negative is 16,173. And number of tests positive is 2,351. And just a reminder, these are number of tests performed, and our test positivity rate is 18%, 14-day average. Again, that's 18%. Also, just to let you know that these numbers are updated weekly on the Winslow Indian Healthcare Center COVID dashboard. We update it weekly. We also have graphs on there as well that show the numbers and the waves that we're going through and whatnot. So that's the quick update from Winslow Indian Healthcare Center. And next, I believe, is Denise. Thank you.
Hello, my name is Denise Blackrock, and I'm the Director of Public Health Nursing. So I will be sharing my public health nursing case management numbers with you. I will need to share my screen here, so if you'll give me a second. Okay, so this first graph here is the case management numbers by community. So the communities we're seeing the highest numbers in as far as reservation communities go is Dilcon. As you can see, Dilcon's the yellow line here. And then second is Loop. So those have been our communities that we've seen the highest numbers in so far. But as you can see, there's been increases in pretty much all of even our smaller communities throughout District 5 and District 7. And then this graph here is our cases in our border town communities. So our border towns are Winslow, Holbrook, and Joseph City. So as you can see, we have the most cases in Winslow. As far as Winslow Indian Healthcare Center Public Health Nursing goes, the highest number of cases we have overall, including border town and our reservation communities total, the areas that we serve have been in Winslow. And this next graph here is the numbers we have case managed by age groups. So then the age group that we've seen the highest number of cases in so far is in 25 to 34-year-olds, followed by the 35 to 44-year-olds. And pediatric cases, meaning children 17 and younger, we've had a total of 388 cases that we know of in children. And the age group with the highest numbers have been this 15 to 17-year-olds, followed by the 12 to 14-year-olds. And then this last slide here is our number of cases that we've gotten in every day for case management. So our cases include the patients that were tested at Winslow Indian Healthcare Center, as well as patients who are tested at other facilities, but who live within our service area. So they send those to us to do the contact tracing on and to follow the people during their isolation period. So as you can see, we're still pretty high in this area. And like I said, my numbers go up to the third. So I'm expecting a little bit of high numbers still right in here in these ones. let's see, from the November like 29th to the beginning of December. So these are kind of our Thanksgiving numbers that are right in here, these little spikes here. And then our Christmas ones, we're starting to see some higher ones here. So with my next set of data, we'll be able to see those ones. But we have seen some increases due to Christmas and New Year's get-togethers. And so far for public health nursing, we have case managed a total of 2,760 cases throughout our service unit. And that is it for the information I have. Thank you.
Thank you very much, Alicia and Denise, for that valuable information. As you all can see, we are now kind of getting those numbers from the holidays. So now we're going to turn the time over to Dr. Del Yazzie, epidemiologist with the Navajo Nation Department of Health. Are you there, Dr. Del?
Yes, I'm here. Thank you, Pax. I wanted you to tell a joke first.
Next time.
Can you see my screen?
Yes, you can see screen.
Good. Let me see if I can make it into presentation mode. Okay, here we go, guys. Thank you. Yeah. My name is Del. I'm with the Health Command Operations Center for COVID out of Window Rock, Department of Health. I am a part of the epidemiology team here. And what I'm going to present here is our gating measures update that we do every 2 weeks. And this update represents time period December 25th through January 7th. And just very quickly, these are the left column. These are the measures or indicators that we look at every 2 weeks. There's cases, testing, hospital capacity, public health capacity, disease spread, and the recommended control effort to reduce spread. So this is the first, these are cases. This is what we call our epi curve. So back in May, we had our first wave and our first peak in COVID cases on Navajo Nation. And then if you can see here, we're in our second wave currently. And it looks like we're beginning to go on this downward trend or downward trajectory for the past week and a half or so. And I'm gonna zoom in a little bit for a more recent date. So we're plateauing. Here was Thanksgiving, here's Christmas, here's New Year's. So we're going on this downward trajectory, which is a great sign across Navajo Nation, but it's still a little too early to tell if we're gonna continue to go down or not. Hopefully we will, because New Year's just happened a week and a half ago. So we'll continue to monitor that as we move forward according to our data. And then this is just comparison between Navajo Nation and the orange curve, and the blue one is the United States COVID curve. And as we're continuing to go down on this downward trajectory, which again, that's a great sign. But the United States as a whole, they're continuing, they're going back up. So, and that's not, of course, not a really good sign for us, especially our neighboring states, and I'll cover that too. So here it is. So this is our heat map. There's average daily cases per 100,000. The darker blue or the darker purple shade, Chinle, Shiprock, Crown Point service areas. And then the state of Arizona, they're the higher disease risk of 100 to 199 average daily case per 100,000. So they're seeing more cases for Navajo Nation, including the state of Arizona. So this just shows that. And then this is incidence, where we compare ourselves to the 50 United States, plus a couple jurisdiction areas. And we are in this yellow bar, we are in 9th position, comparing us to the 50 states. So we were actually at 1 the last time, a couple of weeks ago, and we're trending the right way. So we're now at 9th in the past week. So that's also a good sign. However, Arizona is now number 2 in the country with most COVID cases. And then Utah is up there too. And then New Mexico and Colorado, they're further down. So our neighboring states are seeing, especially Arizona and Utah, are seeing a lot of COVID cases currently. And this is by chapters, our heat map. Again, these darker shaded blue, purple areas are currently our priority areas, like Cameron, Chapter, Ganeth, and Tease, and Shiprock, Upper Fruitland, Baca Pruitt, Tohajile, and I believe this is Church Rock. So those are some of the darker shaded purple areas that are seeing a lot of or increased COVID cases currently. And then this is our percent positivity for COVID testing. Currently, we're at 24% for a 7-day average. So we're continue to see COVID cases, and the percent positivity is at 24%. And then this is hospital capacity for inpatient hospital beds. And then this is ICU beds. For hospital beds, this red dotted line is the 80% threshold. So it's a good sign that we're below that. The green, darker green color is Navajo Nation overall. So we're at about 60% of inpatient hospital beds that are occupied. But if you go to the ICU beds, we're a little closer to this red dotted line. So even though Navajo Nation as a whole, we're below it, we are about 72% or so of meeting that threshold. So we're very close to that, and that continues to remain a concern. And then comparing to the states, the green is New Mexico. They're way above this red dotted line, so they're seeing a lot of cases, and their hospital beds are currently fully occupied. Plus the Utah is the yellow, blue is Arizona, so they're all above the 80% threshold. So that's a big concern, because we refer our patients, COVID patients, off the res for specialty care. So that's a concern as well. And then public health capacity, when it comes to contact tracers, we are currently at 438 contact tracers on Navajo, but there are only 2 contact tracers for every new daily case. We want this 2 to be at least 5. So we're not meeting that gating criterion. So that's also, we're trying to add more contact tracers currently across Navajo. So in conclusion, we didn't meet any of the gating criteria, so we remain at phase 0. Our disease spread is still extensive community spread, and therefore the disease risk remains really high. And the recommended control to reduce spread is shelter in place. So that's a current, President Nez and his staff or his office, we have that shelter in place public health order in place currently, as you all know. So there's no, the weekend shutdowns are part of that shelter in place. So, and then just a couple more slides. Navajo Nation border states, Arizona, Utah, as I said, are seeing a lot of cases. Colorado and New Mexico are in the lighter shaded red, so they're also, still seeing cases. And so are we, Navajo Nation as a whole. So, and then this is United States wide. The state of Arizona and state of Utah are in this severe outbreak risk level status. And then Utah and New Mexico are in the active or imminent outbreak risk level status. And then by counties, all of the counties essentially in the state of Arizona is all in this darker red shaded color, which is severe outbreak risk level. And then just in Utah, the San Juan County in Utah is also the darker shaded red. And then San Juan County in New Mexico and McKinley County in New Mexico are also in this darker shaded red. So all of our surrounding areas are seeing a lot of COVID cases still currently. And that's my presentation. Max, I don't know if there are any questions. Thank you.
Thank you very much for that valuable information. Ladies and gentlemen, those of you that are listening, those of you that are live with us here this evening, this is the reason why we're all continuing to say, please abide by the CDC guidelines. COVID is still out there, it's still around. And a lot of people are acting like it's not, just because the vaccine's here. But I'm just saying that continue to be careful, continue to wear your mask, continue to avoid gatherings, continue to stay 6 feet apart. So thank you very much for that valuable information. And now we're going to go to the Navajo County, and I believe Sasha is going to cover the Navajo County statistics. Go ahead, Sasha.
Okay, so I'm going to provide the Navajo County, just actually go over it real briefly. You can also find the same information on the county dashboard on their website, which is written below the title here. And so I encourage you to stay updated with our current data in your area. So right now at this time, as of Monday, there was 43 new cases off tribal lands. So you'll see that with Navajo Nation numbers, they do keep track of all the numbers on Navajo Nation tribal lands. And so Navajo County, the website is reporting the new cases that were off tribal lands. So 43 new cases within the 24 hours. And you'll see their trends of the new cases day by day on this website. So far there's a total of 5,143 COVID cases since the beginning of the pandemic. Here is the positivity rate report for Navajo County, which is at 25.8%. So pretty much coincides with what Navajo Nation's reporting at 24%, and then what we've reported in our area, 18%. So Navajo County is 25.8%, still very high. And there's a breakdown here of the age ranges. So we see that the majority of the COVID cases are among the 20-year-olds to 44-year-olds. And I wanted to just share with you briefly the current resource for COVID vaccines from Navajo County Health Department, and we'll go over the COVID vaccine information for Winslow Indian Healthcare Center. But for Navajo County, you can refer to their website, and it'll provide you with this information as where you can sign up to receive the COVID vaccine. So this is the conclusion of my presentation for Navajo County.
Thank you, Sasha. We are now going to go over to the Coconino County, and that's going to be presented by Matt Maurer.
Yeah, hi everybody. Good evening. Lead epidemiologist for Coconino County, and I'll review some of the data that has been shared by some of my colleagues already. As Del was mentioning, Arizona as a whole has a very high number of cases, a very high rate. A little closer look. Let me share my screen real quick, and we'll give a closer look as to what is taking place in Coconino County. Our situation is the worst that we've seen yet as far as this outbreak goes. Let's pull up this one right here. Can everybody see my screen?
We can see the screen, but there is nothing coming up yet.
Oh, okay.
There we go.
Got it.
Can you see
Yes.
our epi curve here showing
Yes.
the numbers per week of the cases? Great, perfect. So as you can see right here, just this past week, this is the week ending January 9th. We've had the highest number of reported cases. This is countywide for Coconino that we've seen yet for the entire outbreak. All of December has been very high as far as case counts and transmission. Coconino County is within a substantial level of community transmission. Our incident rate is very high, upwards. The substantial threshold is 100 cases per 100, over 600 per 100,000. The positivity yield for substantial is above 10%, and we were at 19.8. We were close to 20% positivity yield, and our COVID-like illness is at 24%. The substantial threshold is 10% for that as well. So very, very high numbers that we are seeing within Coconino County. And as was mentioned previously by Del, some of the tribal communities that are within Coconino County as well as neighboring are seeing increased cases. This brown line right here are tribal communities for Coconino County. And as you can see, elevated slight decrease over the last few weeks, with last week increasing once again. So numbers, rates, very, very high. Taking a look at real quick what's going on with our schools. This at the bottom shows our benchmarks and where we're at with our, as well as our recommended delivery model of virtual for the county as a whole. And then you can see all 8 school districts within Coconino County are in that same area. Tuba City Unified, a little bit more detailed look into what is taking place within that school district. This green line here is Tuba City. So you can see the increase that we had for week 53, up to 121 cases for that school district there, and most school districts neighboring as well. This shows the case rate. So you can see the rate here for Tuba City Unified up at 1,040. Very, very high, as well as some of the other at Williams, Grand Canyon, as well as Flagstaff, which includes, you can see the zip codes here, includes a number of zip codes for Navajo Nation within that Flagstaff Unified. And a little bit of our age breakdown that's taking place. Most cases are within the 25 to 44-year-old age group. However, school age, kids 0 to 17, have seen increases more recently, as well as our college age of 18 to 24. And so that's what I wanted to share with you today. I do, just as was mentioned already, I do want to reiterate those prevention strategies. Please, please, please avoid public settings if not necessary. If you do go into the public, make sure you do wear your mask. Try to keep distance as best you can, 6 feet at minimum. Before touching your eyes, your nose, your mouth, before eating, please wash your hands, sanitize as best you can. It really helps to prevent transmission of this virus by washing your hands after you're in a public place. And if you don't feel good, please, please, please just stay home. Those are some of the best things that the strategies that we have seen that are working as long as we all continue to follow them. So thank you.
Hey, Matt, thank you very much for that information. Thank you for the encouragement as well. And those of you, again, watching here live and watching this live stream, also the town hall meeting here, please listen to these professionals. And it's very important that we come together on this whole issue. So we're going to go on. And now we're going to talk a little bit about the COVID-19 vaccine. And that's going to be given by Sage White, who is the Ambulatory Care Director for Winslow Indian Healthcare Center. Go ahead, Sage.
Hi, and I'm going to share, I have a little PowerPoint on. All right. All right, can you guys see that okay?
Yes, we can.
Okay, so what I wanted to first do is just talk a little bit about the mRNA vaccine. I'll try and keep the presentation part short so we can answer any questions that people might have. But essentially, both the vaccines that are being offered right now at the Winslow Indian Healthcare Center and that are approved in the U.S. are mRNA-based vaccines, the Pfizer and the Mrna vaccine. So they work in a similar way. They essentially you can see the purple vaccine particles here have a little piece of the genetic information from the COVID-19 virus. And that piece of information that's been chosen is for this spike protein that we see on all the pictures. And that spike protein is how the virus gets into our cells when we get infected. So it takes that little piece of genetic information, wraps it in a lipid particle, so kind of like a fatty layer. And that fatty layer is also what happens to surround your cells. So those vaccine fatty layers kind of fuse, and the genetic information for the spike protein gets into your cell, and then it uses your your cell production factory to make it spike proteins and put spike proteins on your cell. So what it kind of is doing is then tricking your body into thinking you've been infected with the virus that has the spike protein, and your body can then make other protections against those spike proteins that are already active and available, so that when you do get infected with the virus, your body already knows what it's looking for and you don't get sick. So a couple specifics about the two vaccines. They're both 2 shots. You need both shots to get full protection. There's not data yet on if you only get 1 shot, how much protection do you have? And, there might be talk about that you hear in the news and stuff, but right now you need both shots. The Pfizer shot's 3 weeks apart and the Mrna is 4 weeks apart. Have this emergency use authorization from the FDA. So it's not full FDA approval, but it's kind of, we're in a public health emergency. We have good data on these. And so we're going to release them with an abbreviated process, essentially. Pfizer is available for those 16 and older, Mrna for 18 and older. So there's no vaccine yet for pediatric, young kids. Just a few, the Pfizer, 12 days after your first dose, you do get a little bit of protection, full protection, about 50%. And then a week after the second dose, and really for both is when you're at full protection capacity. So what that means, it's going to be important for you to continue doing all the things that people have just been telling you to do, wearing a mask, social distancing, here after your first dose of vaccine and really after your second dose of vaccine, and I'll go into that a little bit more in a minute. But a lot of people hear a few questions that we've been getting frequently. Should I get the vaccine if I already had COVID? The answer is yes, but you don't need it right away. So usually we recommend about 90 days after. And that reason is that you can't get reinfected for sure within that 90 days. It could be longer, but you're already protected during that time. So we're saying, wait, let someone who's not protected get vaccinated, and then you can get vaccinated when you're outside, when you're at that 90 days or after. So say you just got the flu shot, vaccine. Right now, the recommendation is to wait 2 weeks between vaccines, 30 days for live vaccines, but those are less common. So, but it is something to think about. If someone offers you a flu shot, when are you going to be able to get the COVID vaccine? Is it going to be interfere with you getting that vaccine? Another thing is people say, oh, I heard that if you have allergies, you shouldn't get it. Well, so if you have an allergy to an ingredient in the vaccine, certainly you shouldn't get it. There have been some people that there was the case reports of 2 people in England who had an anaphylactic reaction to the vaccine. So if we're just recommending, if you've had a history of an anaphylactic reaction, bring your EpiPen. We're monitoring you for a little bit longer, but we haven't had any major reactions. I'm pregnant or I'm breastfeeding. We don't have that data yet. It's being studied, but it's not a hard no, but it's a maybe. You should really kind of talk to your provider, see what your risk of getting COVID is compared to the risk of the vaccine, and kind of make a decision based on that. So when you get the vaccine, what can you expect? So here's some common side: sore arm, fatigue, headache, muscle pain, body aches, chills, some joint pains. These are more common after the second dose, and they're actually more common in younger people. These side effects are all actually good signs because they are all symptoms that are occurring because your immune system is being activated and is working. So it's not a bad thing to have these side effects. It might make you feel a little bad for 24 hours. Most people, it's 24, 48 hours, and then they're back to normal. But it is a sign that the vaccine's working and you're building up that protection. So who's getting the vaccine right now? So we are in kind of the phase 1A and the top of phase 1B. There, you see where the red line is around. So that is 65 and older, high-risk patients, and then adults in, nursing homes or living in assisted living facilities as well. Phase 1B is big, as you can see, and kind of has a couple steps. And so we're currently at that first step of phase 1B, and then anyone, of course, in phase 1A as well. And that will hopefully expand as we continue to get a more steady supply of vaccines. So say you get the shot, what should you be doing? So one is, we don't know how long the protection is going to last. So that will be an ongoing study. Will we need to get the vaccine every year, every 2 years, to be determined. And then after the first dose, you're not fully protected. You need both, which I mentioned earlier. And then one thing that wasn't studied was, say I get the vaccine, I'm protected from getting symptomatic disease. So I'm not going to have COVID symptoms, but what if I get exposed? Can I spread it to somebody? Essentially, do I turn into an asymptomatic carrier? And we don't know. So that's why it's important to continue to wear your mask, continue to wash hands, do social distancing, even after you've had both doses of the vaccine, because if you're around people who haven't had the vaccine, we don't know the answer to, could I still spread it to them? And you don't want to be, so you're protected, but it's still going to be really important to protect other people in our community. All right, so if anybody has questions, I know, let me stop sharing. Sasha asked me to address the question about the new strains that we're hearing coming out of England and South Africa. And I just was listening to commentary, kind of the most up-to-date science. There is essentially, we don't believe it will affect, that the vaccine should still be effective, because where the changes are on the spike protein that potentially make this variant more catching or more transmissible is not going to affect the ability of the antibodies you make from the vaccine to find that virus and get rid of it. So that's good news. There's no clinical studies yet because these variants are so new, but the best scientific guess essentially right now is that the vaccines will continue to work for these variants. So if people, I guess if people want to put questions in the chat, or if people don't have questions, that's fine, but I'm happy to answer. And I'm sure Dr. Dovo can answer questions too.
Sage, thank you very much for that awesome presentation. We do have a survey and a link at the Facebook Live chat box. The link, you guys can go there and ask questions. Feel free to do so. We'll get to those questions later. But Sage, thank you so much for all you do and what you do. So we appreciate you. Thank you. And we're going to continue to move on here. We're going to go on to our next presenter. And our next presenter is from the Department of Education. Shajah Aj ek Barnard Afnan, Mr. White, Otto, Mrs. Ghani as well. So go ahead, Dr. White.
Oh yeah, those are the coach international without the nation, originally from Wycombe, Arizona, and we were asked interim superintendent Ms. Ghani and I to give an update on the education part of our work regarding COVID-19. So report on the aspect of mental health that I've been tasked with to look and address the mental health issue related to how it's affecting students, parents, teachers, school staff, as well as community in general. I'll report on that, and Ms. Ghani has updated information, these new school opening plans that we are going to be initiating here. So, and other information that she's been working on with our tribal leaders. Pandemic COVID-19, we've been to address the mental health, how it is impacting. In this case, we're looking at student learning, because what we're beginning to hear, observe, is that in the school systems, whether they're state public schools like Winslow School District, other public schools, DIE funded schools, they not collect mental health data, which is never a requirement from them based on their accountability. They address teaching, they address teacher qualifications, they address student learning. Now we're pushed into their of mental health in the aspect of wellness and well-being. Learned from this pandemic is that there is a great weakness in our school systems with regard to health types of interventions. And so be it, because schools were not charged and tasked to give and provide mental health services. They were charged and tasked to deliver instruction and teach. The common, you might say, the common gesture of many of our schools and administrators is to train teachers to be mental health types of individuals. Here now that we're beginning to realize that in schools and in the general Navajo public, that particular aspect of wellness is limited. And those services that are provided right now are challenged. Because, for example, the Winslow Hospital, the 638 Hospital, has care facilities for mental health that are on premise. And whether those practitioners go out and offer services, that's very limited. And education is working with leaders and teachers and a federal agency to address that. That's going to be a new avenue of information sharing that we're seeking. from schools. So just wanted to update that part of it. Our task to provide data-driven types of decisions, data information grounded in data to our tribal leaders to make informed decisions with regard to mental health. And throughout the pandemic, all the way up to now, the people say mental health, okay, but what education is doing is trying to put some definition to that. Mental health does not necessarily meet the criteria of social learning. That is a part of it, but mental health is the greater, you might say, the greater category of wellness that includes a variety of types of interventions. So we're forward to address issue and be but more concrete in our definition of that. So I wanted to share that update with each and every one of you since we've shared our update in the Winslow Town Hall. And I think this is a great idea for Winslow Hospital to have a town hall meeting, because we look at the students, where they're coming from in the Winslow district, and a lot of the good kind relatives that live in the area where you service. So they need to know, they need to be informed of the types of education and the greater issues like the Department of Health, the good report that we heard on the pandemic, the data that drives decisions. I know that that's something that is very unique to the Navajo Nation, to have our own epicenter to drive that information. Same way we're piecing that together with the mental health piece of it. So I'm going to stop right there, and then thank you for giving me this opportunity. And I turn this time over to my daughter, Ms. Pat Gani. Thank you, Sam. Thank you for listening.
Thank you, Dr. White, Otto, Mr. Harvey, thank you for facilitating the conversation this evening with Winslow area. I wanted to be able to share my screen here, so I did ask for share screen. So let me pull up a document that I want to share with the group here. Application window. Share. Okay. So again, as introduced, I am Patricia Gani. I am acting superintendent for Department of the Net Education. Tsinajini nashlido ashin bashishchin tachitni dashachedo thodechini dashanale ado Rough Rock, Arizona ade eya eyasina sha zetlajin betsido. So I just want to extend my my welcome to everyone, and thank you for allowing Department of the Net Education to share updates regarding school reopening. So as Dr. White spoke about the needs of mental health of students and employees within school settings as we work toward school reopening, we will continue to collaborate with you as we work towards finding resources for schools to utilize. As he eloquently explained, the needs surrounding mental health wellness for our families, students, and employees during this pandemic. So we will be having a special Navajo Nation Board of Education meeting on Wednesday, at which time we are bringing before the board a request for their approval of this updated school reopening. In months before, when they initially reviewed and approved this document, It was called an interim guidance for phased reopening, at which time we wanted to work closely with our schools in understanding the need for cooperation from all types of schools, public schools, across the 3 states that we work with, in understanding the reasons why the nation is closed, hence the schools closures, and how we needed to collaborate together during this health crisis. And since then, there have been some issues with a number of schools that wanted to align themselves with their local authorities. And so this document comes as a result of the need to strengthening language in terms of Department of the Net Education and the nation exercising its authority to protect the health of the Navajo citizens. So this is a document that contains that strengthened language during this pandemic, but I more specifically wanted to be able to highlight the various statuses, status 0, 1, 2, and 3, as we move toward the phased reopening. As was mentioned by our health care providers this evening, we are in the red phase based on public health orders and information that is gathered and reviewed on a daily basis from Navajo Department of Health is what drives this very criterion here. We do have a gating criteria, also managed and overseen by Navajo Department of Health. And that's how this color-coded status schedule for resuming in-person classroom instruction and operations is aligned to. So we are here in the red phase based on the shelter-in-place public health orders. And we will be here for virtual instruction until such a time things improve to the degree that we can be moved along to the next orange phase, where we are able to still maintain virtual instruction for a period of time until we can see things become ameliorated in terms of the number of COVID cases, and then also the vaccination schedules taking hold. And as those things become better, we will, we're hoping to see ourselves move along to the yellow phase here, at which time schools have the flexibility of invoking a hybrid model for student and staff members' safe return to a level of in-person learning. And of course, as things continue to progress for the better, we hope to see ourselves in a green zone, the green state, at which time we do foresee a hybrid model as well, but it will be a progression from what we see and start with in the yellow phase. So we do have at DOTI level a task group who Dr. White is working with. The task group for school safety is comprised of school principals and superintendents here on Navajo Nation, who provide input on identifying critical issues at school level, and then offering recommendations for consideration in many instances of the decision-making bodies of Navajo Board of Education, the executive branch, and then also Navajo Nation Council with the legislative branch as well, for their support in asking for various types of remedies that may require their action. So we want to utilize that task group soon here to help us explore the types of hybrid models there are. How do we begin in a hybrid model when we reach that yellow stage? Does that look like the younger grades only returning to in-person learning by cohorts? Or is it the high school grades that will return to in-person learning while we continue to have our students in online learning for the elementary grades? So those are some of the various types of thoughts and ideas that we would like for this task group for school safety to help provide input to DOTI leadership in structuring some of these options that are safe for schools to work with. And so I just wanted to be able to share this part of the Navajo Nation reopening plan that will be made available to all of the schools that are located within the geographical boundaries of Navajo Nation, subsequent to the board's approval of this document on Wednesday of this week in their special meeting. And so just wanted to have this information out there. We are trying to be methodical, but also giving a lot of credence to the health professionals in terms of helping us understand and carefully move between these status for resuming in-person learning. So having said that, I just want to also remind everyone that schools on Navajo remain in an online learning format for the second semester. That is another action item on the board's agenda on Wednesday. We wanted to make sure that we have specific language for second semester, so that resolution will be on their agenda on Wednesday. So with that, we do also have Navajo Nation Council who have supported us in offering the flexibility of schools located on Navajo to provide a level of in-person learning for special education students. So we have been carefully working with all of the school leaders across Navajo, helping them understand how to make that professional judgment of which students with IEPs would require in-person learning. As we do continue to have these public health orders in place to minimize movement, schools are asked to really work with their special education population information in making those determinations as to which students they require to have in-person learning. So with that, I just want to again extend my appreciation for the invitation to myself and Dr. White to continue to provide these updates. As of this week, Navajo Nation Head Start programs have resumed services. Office of Dene Youth programs have also resumed virtual services this week as well. Thank you. Thank you, Mr. Harvey. Back to you.
Oh, yeah. Yeah, Mr. White, Nana, Mrs. Ghani, Mijonabo, Nata, Lado, Koto, Hanat Yat, Egin, Jonagi, Thank you very much for your wonderful job and what you guys are doing for our students in the schools and the teachers out there. We appreciate you, and continue to be safe as well out there. So we will see you at this town hall meeting. And those of you that are listening again, thank you very much for tuning in with us, being here with us. And this has become almost like a weekly, bi-weekly thing that we're doing from Winslow Indian Healthcare Center to give you guys information, feedback out there. We do appreciate your feedback. We want your feedback too. So make sure you go to the Facebook Live chat box, click on the link for the survey, give us a survey, give us your input. And that's how we come up with these topics of our town hall meetings. So now we're going to go ahead and go over to Sasha. She's going to give us some information about the community resources. Sasha?
Hi again. Let me go ahead and share my screen and the presentation I have for you. So I'm going to go go over the COVID vaccine clinic information that a lot of you are probably curious about and wanting to know more information about what Winslow Indian Healthcare Center is providing with COVID vaccine clinic services. So right now, I just wanted to inform you that we are providing the COVID vaccine clinic at this time here in Winslow, Tuesday through Fridays from 9 a.m. to 4 p.m. and they are provided by appointment only. So just want to let you know that it's by appointment only, and we have our staff that are scheduling these appointments, the clinical care coordinators or other staff who have been assigned to schedule those appointments. We do have some community clinics scheduled for next week, January 19th, Tuesday, Delcon Clinic. It's going to be from 9 a.m. to 3 p.m. again by appointment only. January 21st, Thursday at Loop Clinic, 9 a.m. to 3 p.m. by appointment only. We are currently scheduling patients who are 65 years and older, and as well as patients who are in the high risk category. So as Dr. White went over earlier with the phases that we're going by, and so this is what we're providing at this time. I know a lot of people are eager to get this vaccine, and we do know that, we do keep that in mind, especially the school staff and leaders. So we are continuing to stay in communication with you about that. And then just wanted to let you know, remind you that we do have COVID testing that's still available here at the Winslow Clinic site, drive-through testing Monday through Friday, 9 a.m. to 4 p.m. Okay, and then I just wanted to share with you all too that this time and this town hall meeting came about just with in the past months of our work with all the schools and with all the leaders of your school, even your school health staff, and finding out the best way we could help and we could be a resource to your schools. So through that, we have been helping and being just a resource to your schools as far as how they should provide COVID response plans and decisions. And so we do go by the CDC guidelines. And so we do try to provide the most up-to-date information and try to provide in services and help out the schools the best we can as they need. And they do have a lot of help too from the county health department, as well as Arizona Department of Health and our Navajo Nation Health Command Center. So we have provided them with a tool called the COVID response plan. So the schools are able to figure out what to do when they have a parent or staff member report COVID-like symptoms, or when somebody reports that they have been exposed to COVID. These precautions still continue to be the same as it's been from the beginning, and just knowing what it means to have exposure or direct contact. And also the list of the symptoms, COVID-like symptoms, have not changed, and some people experience all of these symptoms, some experience maybe one or two of them. And since we're in a pandemic, we still need to continue to take precautions and not assume it's a common cold or it's only allergies, because that's how a lot of outbreaks have taken place because of that. So don't take this lightly. It is considered excessive spread. So it is possible, even if a person just went out to the stores and that's the only place they went, it's possible that that's where they caught COVID. So there's a lot of different scenarios. A lot of workplaces are having outbreaks, and that's how it's being brought into the homes. So be very cautious, and also with kids spending time with one another, wanting to visit friends, wanting to hang out with friends. Continue to be cautious. So this is what the schools have to help guide them But again, like we said, there are guidance from the Arizona Department of Health and CDC. And this is just specific to our area with the information that they could refer to as far as who they call. And we also have one available. Maybe you already seen this. This one is specific to the parents. So basically every day, if your child is attending school in person at this time, which we do have schools that are attending school in person. They have students. And we ask that you continue to practice this protocol every day, that you continue to check with your child every day to find out if they feel well, if they have any symptoms. Please do not send them to school. And we ask too that you do not medicate them with Tylenol or ibuprofen just so that it can mask fevers and send them to school. We ask that you not do that, not at this time, because we're in a pandemic. The numbers are excessively high. They're continuing to be widespread. So this algorithm here, it guides you with that of asking your child how they feel. And also, if any of the children have symptoms, we ask that you keep even their siblings home as well and monitor them, and even consider if you should get your child tested for COVID or not. So we did share this with all the schools and encourage them to provide this information to all the parents, either by email or on their websites. And they've been pretty good about sharing these information with all the parents. So just wanted to let you know that that's kind of how we're trying to help too, help provide information. And then I wanted to provide, just share with you, we got some feedback from our survey. So I continue to ask you to keep send in your surveys. We do take your comments and your requests into consideration. So just real quickly, I wanted to share with you, and this meeting is recorded. So if I pass by the slides, you're always going to be able to go back to it. But a lot of times, even in this time with COVID, when families are impacted by COVID, a lot of times it's made it hard for getting food and supplies. So we do have food and supplies resources. Just wanted to let you know that these are available in our communities. And there are some, you can jot down the phone numbers and you can look at this real quickly, but there are food pantries out there. There are ways to get supplies. A lot of times families are impacted. They need certain items for their family. So these are places that you could reach out to. Some of them may be able or willing to drop off a care package to your doorstep to take, and with taking all COVID precautions. We do work closely with our community health representatives, and we partner with our public health nurses, the contact tracers. We're in contact with them. So we do try to help out the best way we can in getting different emergency food and supplies to families. So this is the food and supplies resources that we know of. If you have other resources that you want to share with us, we can add that to our list too, and that would be great to share with our community. Water, right now we have, you would contact your local chapter first to see how you could get some water if you are a family that has to haul water. Also, there is the Dig Deep Navajo Water Project. And here we have a point of contact, an email address, phone number, and what they help with is potable water, water refills, and water tanks. So that's a resource that we know of right now at this time. And then the next one would be our wood. Wood, right now, there is not currently a resource for wood in the communities. Unfortunately, there was in the past few months, and right now at this time, I checked to update that, and there's no emergency wood resources at this time. So just wanted to share that with you. Wanted to share with you and reiterate that in this time of the pandemic, many families have been impacted, even children impacted with worry, anxiety, fear, and just want to encourage you, families, parents, school staff. We do have our mental health department here. You can call and schedule appointments, and they can talk with you over the phone and work with you in helping you, counsel you. We also have the Navajo Nation Department of Behavioral Health. We have an office in Delcon. So, you have resources out there. And then again, continue to reach out to your spiritual leaders, to local churches for help, because that's also important too, that we continue to persevere, stay strong in this time, and be mindful of everything. So just wanted to reiterate that. And that's what I have as far as sharing information. Thank you.
Yeah, thank you, Sasha, for that valuable information. And right now, we're going to be moving into the direction of the closing remarks. So do we have the CEO online with us? Do we have Sally Pete, are you with us this evening? If not, Lita, can you give us a closing remark, please?
I would like to say thank you, everybody, on behalf of Winslow Indian Healthcare Center leadership, and would like to express my appreciation to my coworkers, my colleagues, and our presenters who we partner with from the counties, Navajo Nation, and the schools, along with other community partners and leadership across the Navajo Nation and here within the Winslow service area. Thank you again. Really appreciate the presentation and situating the severity of the COVID-19 spread within our service area. It is very important that we have that knowledge available to ourselves, to as a team, and to our communities to make sure that that information is out there. So I would like to say thank you again to everybody. Ado, some areas that really came through for me as I'm sitting here. Really appreciate that that attention is given to our children and to the parents, to the guardians, and those of us who are raising young ones, and they are precious. And this COVID-19 did impact their journey in their education. And then the part that I also really appreciate, and this is from our support that we're getting from our tribal leadership, our governance, that life is sacred and that it is precious and that we have to protect our children. And we really have to really look at every perspective when we're mitigating as we're coming together to make sure that safety is there for our children, and we continue, even though this is going on, that they still want to learn, they still want to be active, but we're reframing the safety and what is normal today. So I just want to say thank you, and there is quite a bit of information that was shared regarding the vaccination. And we've been providing, offering the vaccination based upon the priority list, and very few of our community members have refused to get the vaccine. And then the way that we offer and provide the vaccine through curbside has been, it is safe to get your vaccine, and the way it's set up through our facility is we monitor our patients when they do get it, and that we do make sure that we provide the information, the educational information that goes with the vaccine, and we do get the support again even at the front lines from our providers, and there's several of them sitting in on this presentation who are a part of it, and they're always there. So I just want to say thank you, and Pax, thank you for being the moderator. Shiaj and Sasha, thank you. And then other team members, Denise and Lisha, thank you again. So everybody have a good evening. Yeah.
Yeah, thank you very much for that awesome presentation and awesome expression to all of us here. All of you that came on here, again, all the professionals that shared their information, thank you so much. Also to everyone that's tuned in, everyone that's watching, thank you guys very much. You can always go back if you missed something. This video will be available on Facebook Live, also on our website as well. And also you can always go to that when you get a chance. And again, go to the link, the survey link, give us your feedback. And then everyone out there, again, be safe, be careful. Continue to follow the guidelines, please. Continue to wear your mask. Continue to wash your hands 6 feet apart. Stay away from family gatherings. I know a lot of you are still gathering. Even though it's your family, be careful of that. And also, just want to send you guys off with a very good thought of, again, this is all done with care and sincerity. We care about you. That's why we're doing this. And each and every one of us, we want to make sure that everyone's safe in our Winslow service unit. So thank you guys very much. And we had a couple of questions. So there was one question that was asked about how can I become a contact tracer? Who can answer that for us here? Is it Denise? Somebody is asking about becoming a contact tracer. Let's answer that. Maybe Rita or somebody can answer this.
The question was, how do I become a contact tracer? Was that the question?
Yes.
Okay, so at Winslow, we do have currently a pandemic response technician that's posted as a position description, and we are now hiring in for those positions, and one of the assignments is to do contact tracing. Contact tracing is basically part of the case management process in mitigating COVID-19. We contact, identify positive cases, and then we as a contact tracer, we do the investigation to make sure to identify who was exposed, and then to inform the individuals, and to educate, and then to monitor. So the initial process, or to get started, is to start with, even at curbside, there's some entry-level positions where you get to know what this countermeasure mitigation process is, as from the front lines all the way, and then it can go into case management to assist with those assignments and activities. It's good to have a good understanding, and that way it's not too difficult to take on those assignments.
Thank you, Lita. Yeah, appreciate that. Sally, are you able to unmute yourself? Are you here?
Hello, can you hear me?
There you go. Yes, we can.
Okay. I'm sorry, I was trying to get on and I was just going crazy here. But anyways, thank you very much, everybody. I don't know who's all on the call, but yeah, my name is Sally Pete, Chief Executive Officer. I should title do National Twitter Jamie Bashishin do Coconino County, and I'm originally from Red Valley. But I just want to thank everybody and the staff members that are coordinating the call. And thank you all for the discussions and sharing the information, the comments. And these are, as mentioned, these are very important, as healthcare providers, school staff members, and working with our precious children. And we need to continue to work together to ensure that our children continue to learn and also they are safe. And, it's up to each one of us as parents, grandparents, caretakers, healthcare providers to work together to really make sure that the students follow the directions, the CDC guidelines. There are a lot of challenges with the school closures. Students no longer have in-person access to the classroom learning, interactions with different activities such as with sports, music, a lot of things that goes on in the school. And they don't have the intervention for different services also, like counselors and school nurses and other resources. So there are a lot of anxiety. I'm sure there are a lot of depressions, not only with the students, but members of the family, including the educators. And as we're going through this hardship pandemic, but for our children, some of them, they live in isolated areas and without any basic needs, necessity. So I feel for these children and always watch them when I used to watch them going to the school every morning, but right now it's really quiet. So I just always wonder how they're doing. But some of the kids that are participating in distance learning during this time do not have access to internet. And so it's very, very difficult for some of them. And even the teachers themselves need help. And I know that there are, counselors and special ed teachers, and they're all going through so much, and there's so many challenges. So I think we just need to continue, and I really appreciate the staff members that are here trying to help. And I think we're doing the best we can from Winslow. I don't hear much about this in the other service area. But I just want to make sure that our leaders are supporting us also and promoting, resilience and community, helping each other in the community as we go through this pandemic. But I used to I appreciate each and every one of you. I know that some of these have been discussed already with the vaccination, but it's kind of slow. However, eventually, hopefully, the schools will make decisions about children attending in-person school, and the information for the parents and caregivers will continue for the safety of the children. And so talking about the reopening and with the safety, that is very crucial. So making assessment before that with the children and families, and some of them are at risk. So all those considerations have to be considered before, making plans for the reopening the schools in the future. But that's a long way off, it seems like. But all the factors for better service have to be considered. So with that, I really appreciate all of you for your input. Pax for helping us every time when there's we need help with the community, with the public, and you're usually there to help us. And also Sasha, Lita, you all are doing a good job for helping the schools. And then the public health nurses, I don't know if Denise is on or Luisha. Thank you so much for your help. And all of you that are listening out there, thank you.
Yeah, horrible. Thank you very much. Although, again, everybody, this concludes our meeting today, this evening. So thank you again. We will have another one here. Just look out for it. And again, everybody out there, let's continue to be safe, be careful, abide by the CDC guidelines, and enjoy your evening. Yeah, go on it.